Welcome to HCA Talks Health. I'm Zina Leroux, your host, and today I'm speaking to Sophia Murray John. So she's a registered nurse with over 30 years of experience, and she's also a certified health coach with a lot of experience in NHS healthcare. Welcome, Sophia. It's lovely to have you.
Thank you. It's lovely to be here.
So I want to start with you maybe telling us a little bit more about your background in general in healthcare and how the journey unfolded for you. So we know that you're a nurse, we know you're also a health coach, so tell us all about this journey in healthcare.
I think my journey started back in 1995 where I graduated with a nursing degree, and I started my healthcare journey very much in trauma and intensive care. I loved the variety, I loved the fast paced, I loved working with people, and getting them and helping them to solve problems, resolve some of those broken bones and those life-changing experiences, and actually getting them back onto the road to recovery.
Mm.
In about 2001, I became, I think, fed up with living my life a little bit back to front on occasions. So I'd had enough of nights. Those nights were taking its toll. So I took a position as a practice nurse in a primary healthcare team down in London. This was a massive change. So I was no longer working with people who were, having sudden changes in their life and had a potential to recover. It was very much on working with people to navigate long-term health challenges, um, and, finding a way of actually managing these in the long term. So there was no solutions as such. But I really enjoyed, again, the variety, but also working alongside people to find, a way to manage. I think my career has been mainly as a practice nurse for the last 23 years. And I've seen some massive changes there. Our understanding of health, our health conditions, our health challenges that we see has grown massively. And medical science has really changed a lot of that role as a practice nurse in primary care. I was seeing a lot of people with multiple conditions, various health targets we were chasing. We were talking about preventing and managing diseases very much on a physical level. Um, and, I'd gone from working alongside to seeing people for about 20, 30 minutes per year, getting them to review their health against these health targets and actually then trying to find a solution to help them manage some of the symptoms.
Mm. Yeah, so that was specifically in the NHS, right? The
Yeah,
20 to 30
yeah,
minutes. Yeah. But I know
absolutely.
that you've got a vision. So you've got a vision to generate change in healthcare provision, and I'm sure this is also because you've worked in the NHS for quite some time. So can you tell us a little bit more about this vision and what that would look like?
Yeah, absolutely. I think this probably started to kind of percolate probably about 15 years ago. So as a practice nurse, I would see people who were navigating long-term health conditions such as diabetes, asthma, blood pressure, cardiovascular disease. And a lot of the resources that I had available to me was about giving information. Um, and it was almost on that premise of people are not doing the stuff that they need to because they don't know. Now, that is part of it, but my experience didn't really support that. Life's complicated. We talk about following guidelines, following health advice, but life happens and life gets complicated. So I started to think about creating a way of approaching healthcare that was very much in line with the long-term plan that was set out in 2019 for the NHS. It's more personalised approach. It talks about individualising care, and it's more about getting the person to what it means for them to be healthy and navigate their health conditions rather than just chasing targets, which was something that we found ourselves doing, chasing those lovely health indicators like perfect blood pressure, perfect blood
Mm.
sugar. Um, So I'd love to see a system that really empowers people to play an active role in their healthcare, take control of their health and start making decisions that are actually meaningful to them. You know, I'd also really, really love to change this presumption that our health inevitably declines as we get older.
Mm. Yes, that's beautiful. So it's really about bringing in that individualized approach. It's not just reaching your targets, but it's finding out what does health mean to this specific person sitting in front of me. And I guess that's possibly where your interest in health coaching also came in, right? So tell us more about that. How did you find out about the possibility of also including health coaching in your career?
I think probably it was born out of frustration. Um,
Mm,
I was feeling like I was missing something. I was missing a big part. And like I said before, it isn't about just telling people what they need to do. It was trying to stimulate that kind of meaningful for that person, that appetite for change. And often people would come and say, well, I can't do that because it doesn't work. And it was kind of this totality that people would say, well, that approach doesn't work, therefore I'm not even going to think about how it could work for me and how I could adapt it. So I think one of the things that I felt was that I was looking for something. I didn't know what it was, but I was looking for something that was actually going to help me support people to make that change. And actually, it was when I started looking outside the normal streams of healthcare advice and started to look into across the media that I came across health coaching. And I listened to a podcast from the Functional Medicine Coaching Academy on health coaching, and it was almost like I'd found the missing link.
mm,
So I probably didn't think about it massively, but just jumped in and thought, yep, this is exactly what I need to do.
mhm. So most people know what to do, I would say. I think most people do. Although sometimes I am surprised that, some people don't understand what the difference is between a protein and a carbohydrate. So I do think that there is a level of education that is needed in some cases. But typically, as you've mentioned, it's not that people don't know what to do. Most people know they're supposed to not eat as much sugar or carbohydrates, all the refined stuff. But it's about figuring out how can I actually implement this into my life? How can I make it work? And that's where the health coaching comes in, and that's where you felt like there was a gap, and that's the gap that you wanted to fill. So, how has health coaching served you so far in your career since you've started using it? Or firstly, let me ask, how long have you been doing that?
I've been health coaching for the last 3 years, 3 to 4 years, and I started with implementing it is into my nursing, um, into my chronic disease reviews, and I think probably it's actually been a pivotal point in my career. It really opened up my eyes beyond the physicality, the health. We often talk about health and people talk about the physical elements, and we tend to separate the different points of health. um, I now understood a little bit more about what was keeping people stuck. And often when we talk about their health advice, you're absolutely right, a lot of people don't know the ins and outs, but also there's quite a lot of kind of perfectionism in this, of getting your diet just exactly right. We talk about the different food groups and the different components, and for a lot of people that's quite hard because there's other, contributing factors like family time, they're working, they've got kids, other people have a say in their, what they eat or happens in the family. And so, it really started to help me work with people, put them in the center of their health journey, and actually start looking at those little bits that they could take forward that will build into a bigger element of change. And I think that's one thing that I really got, is that it's hard. Making lifestyle changes is really hard, and particularly when you're looking at this total goal that's often not even your own goal, it's because it's been deemed by the powers that be that that is the ultimate picture of health. And for a lot of us, that's quite far away. So as a health coach, I could start actually getting people to see that even those small changes were beneficial, and building their confidence to say, you know, you are an expert in yourself, you're an expert in what works for you. Let's use the information, the advice, the medication, everything that's out there that's going to improve your life, not only now, but also look at reducing some of those health indicators that means that you're less likely to have complications from chronic diseases.
Exactly. Yeah. And I absolutely agree. And I've also seen that often where the vision or what they want to work towards, the ideal when it comes to their health, is just so far away. And it's actually just too
Absolutely.
overwhelming. And then people just give up altogether. Um,
Mm.
and that's the importance of just taking one small step. And I think as a health coach, we've done our job when we've helped someone to just take that one small step. And eventually it builds up. All of those small actions build up to getting them to a place that they're happy with in the end. But I like what you're saying around them being and our clients being at the center of their own health journey. And I think it's a more empowering way to see it and a more empowering perspective to take compared to, it's just genetic, nothing we can do about it. There is
Absolutely.
actually quite a lot that we can do to change the quality of our lives. So I'm curious to know how this all practically works in your life. So how do you incorporate the coaching with the nursing? Is it just in the conversations that you have? What does a typical day or week maybe look like, and how do you incorporate the coaching into all of it?
So I probably 3 years ago, I actually left my nursing job directly because it was tough. You know, you have 20 minutes, you have a series of checks that you need to do, and then to have a coaching conversation in that, it wasn't actually possible to the extent that I really wanted to. I mean, you can always have those little, interventions, those coaching conversations within any appointment. But I actually wanted to work more in depth with people, more, for longer, to actually really get them to put at the center, because I really felt that this was a massive part that was missing. Um, and so a typical week, I work 2 days a week as a health coach in a little rural GP practice up here in north of England. And my days there are massively varied. I work with a variety of people with a variety of challenges. A lot of them are referred to me through the GP and can be from anything from, you know, trying to get on top of their lifestyle and manage their blood sugars because they're diabetic, through to managing an episode of anxiety, panic attacks, and other things. So that's really interesting, and it's such a rich environment in which I get to really experience and put into practice a range of tools. The other days of the week is where I probably have a bit more fun in terms of creating my own workshops. So
Mm,
I spend some time seeing clients one to one who are often facing those long-term health challenges, that would like to find a more holistic approach, so a more whole health approach to their life, create a bit of a better routine and start creating some of their own fundamentals for their health. But I also really enjoy in creating those lifestyle workshops. So that's really an opportunity to help people explore that, all that information that's out there, bring it back to kind of some key fundamentals of what we know about biology, give them an opportunity to actually apply that knowledge and see how it fits in with their life, connect them with their values, and actually create that real desire of a change, and give them a set of tools that they could either build upon or just use or have in a store box, really. I mean, one of the things I work with is that element of emotional eating, and creating a structure and a framework and a set of tools that they have an increased awareness of what they're doing, but also what they can do about it and actually what works for them.
So these lifestyle workshops, is it a once-off thing or do they come for continued sessions, or how does it work?
At the moment, it's a one-stop thing, so it's very much around a topic, and I talk about some of the key pillars of lifestyle that have been put out there from the British Society of Lifestyle Medicine. So it's key elements in that. And it's not almost, I like to get creative and approach health from a different way, because often it isn't just about hitting the actual markers, but it's about understanding ourselves, understanding our health, and also understand those kind of things that contribute to some of those decisions we make.
Mm.
So a lot of this stuff is about getting to know your routine. What
Mm.
is actually going on?
Yeah,
How are things showing up for you? And actually looking and understanding to go, what's serving you and what isn't. Because often a lot of people I would see is that, particularly as a nurse, is that I've been really bad. And I'm like, why have you been really bad? And it's like, because I eat chocolate cake. And it's like, well, that doesn't make you really bad. It's
no,
possibly not supporting your health, perhaps in the quantity that you are. But how can we change that slightly and actually put it into a place where it doesn't affect your health, but you still get enjoyment,
exactly.
if that's what you want to do?
So there's often lots of mindset work that needs to be done as well, right? And I think there's lots
Yeah,
of conditioning around I am bad when I eat chocolate, or the behavior is taken into the identity. So yeah,
absolutely.
that's deep work that often needs to take place to get someone to a place of firstly understanding themselves, but also engaging in the more restorative habits. So you just
Absolutely.
mentioned earlier something about lifestyle medicine. So I know that's another topic that is quite close to your heart. So I think maybe just for those who don't know what it is, can you just clarify, explaining to our listeners what is lifestyle medicine?
So, lifestyle medicine is an evidence-based approach to health and lifestyle, and it's based on three principles here in the UK. It's about acknowledging those social determinants and those health inequalities. It's about having knowledge about the six pillars of health, so things like healthy eating, sleep, physical activity, minimizing harmful substances, emotional health, and mental well-being. Um, and actually having having some tools to help and support people put those principles in place, which health coaching is one of them. um, and actually, as a health coach now, I get to use all my experience and my knowledge of chronic diseases and health and how the NHS works. I actually help people, um, like I said before, put themselves at their health journey, center of their health journey, and actually start making changes that are meaningful to them. And I think it's interesting, isn't it? Is that there's a lot of mindset work that often needs to be done, but it doesn't have to be. So one of my joys is that I don't have to take anyone anywhere where they don't want to go. This is very much client led. We can go as deep as you want to, but I'm not here to suddenly go over all childhood and past experience. It's about what worked, what did you learn from the past, and how we can put it in place. So for some of my clients, it is very much about those steps,
Yeah,
managing their environment, managing little things, little triggers that actually trigger some poor health behaviors. And then it can go straight up to exploring limiting beliefs, where they may have come from, and what the steps they can do to start thinking about changing that narrative.
yeah. And that's not necessarily the role, or it isn't the role of the health coach to go
Mm,
back to trauma and past wounds, although we might become aware of it and
mm,
offer the client the right support going forward in terms of helping them to find the right support going forward. So you might also be a
absolutely.
coordinator, helping them to find the right
Yeah,
support, but also thinking about now that I know this and how this is impacting me, um, how can I look to the future and what do I need in order to work with this, but also possibly make different changes as I go along. Right. So it's not that we're ignoring it, but we're not going to go deep into all the intricacies
no,
around it. But
absolutely.
it's rather about seeing how can we use this going into the future. Right.
Absolutely. I often like to say is that we kind of harness the people's already coping skills, the skills that they have, and actually putting those on the table. I think sometimes I do come across people who don't have those coping skills.
Mm,
And I think that's very much of where you're absolutely right, is forwarding them on and getting them additional support.
mm. So something that quite surprised me was that I read in your bio that you're also a qualified triathlon coach. So please tell us more about that. Did you yourself participate in triathlons, or are you just passionate to support people who do it?
No, I've done a bit of both actually. I think it started many years ago, and it was I had young children, and I needed something, a bit of time for myself, but also a way to keep fit. And I've always enjoyed swimming, but I'm kind of intrinsically lazy when it comes to things like that. So I needed somebody to be standing there telling me what I was doing, when I was doing it, and how hard I was going to be swimming. So I joined the local triathlon club that was quite new, and they didn't have many coaches, and they needed the club was growing, and they needed some assistant coaches to join. And I always enjoy learning and getting new experiences. So I did my level one, and I loved it. I absolutely loved it. It's a sport where people get to set their own goals. It's very much about reaching your potential. It isn't kind of, unless you hit this mark, you're no good. It was very much about people, you know, stretching themselves. And I just really love see people growing in confidence, taking on new challenges, and actually really reaching their potential, whether it was getting their first triathlon done or joining the Great Britain team somewhere in these far off hot countries. I did partake in some triathlons. I don't quite so much now because I'm not very good with competition. I can't be doing with this I've got to be first business. But what I really did enjoy was really stretching myself, getting involved with real challenges. So I've done probably about 3 half Ironmans in my time, which has been great. They are exhausting, and I never quite seem to do enough training in order to really kind of cross the finish line full of joy and bounce. It was
Yeah.
normally like I've got to drag myself, but it tells you a lot, teaches you a lot about your resilience and what you can and cannot do.
Exactly, and it's quite impressive to know that you've stuck it through, right? Even though at times it didn't feel that easy, but you did it. So well done,
Yeah,
quite impressive.
absolutely.
So Sophia, if you could get all of the listeners out there today
Yeah.
to do one thing to improve their health, so you've learned a lot over the years. What would that be?
That's a really good question. I think the key thing that is the strong message that keeps coming through for me as I work with people is stop chasing perfection. And I think
Mm,
that we have this ideal uh, vision of what health looks like, but it tends to be the same for every one of us. You know, life changes, um, life stages change. With each life stage, it brings other challenges. And so often I see a lot of us over 40 kind of chasing those health things that were relevant when we were 20. And I think that, it's a really great opportunity to find out what health looks like for you. Think about some
mm,
key fundamentals for you. Start making those small changes, even one at a time if that works. And actually, find out what actually also makes you healthy now and happy now, rather than chasing this ultimate, weight goal, this ultimate thing. Because even as you reduce your weight, improve your lifestyle, improve your eating habits, there are gains along the way, and we don't often see them.
mm, mm. Exactly, exactly. I really like your advice because I think that's actually one of the things that, ironically enough, compromises many people's health.
Hmm.
The fact that they are chasing perfection, because then they just tend to give up and give in, and I'm
Yeah,
just gonna do whatever I want now because it's not working or I'm not getting to that place of perfection. So I think that's really great advice. But also acknowledging yourself for how far you've come and what you have achieved. And I think sometimes in the health industry, it's always about moving forward, right? What's next? What can I achieve next? What's the next goal compared to where am I now and what can I really be grateful for, and maybe even give myself a bit of a pat on the back for that. So yeah, thank you. That's really useful.
absolutely.
So any last words? Anything else that you still maybe feel like you want to mention, or any last words of wisdom to prospective health coaches out there? Anyone listening, or some of the students may be busy studying to become a health coach?
I think one of the key things, and it took me a while to get to grips with this, but trust the process. You know, people are amazing. Their resilience, their resourcefulness, you know, the ideas and the solutions they come up with when given the chance to do so. You know, I'm still amazed on a daily basis how creative people can be, and often some of their solutions or the steps that they take, I'm thinking, wow, I didn't even think about that. But it is, there is a process, it works. You won't know necessarily the end destination. And I think that's the biggest challenge I've had, because obviously as a nurse in healthcare in the NHS, there's end destination goals, there's measures of success from our point of view. And as a health coach, I now get to, you know, work through that journey with them, and people get to define their own destinations.
Yeah, and isn't it lovely to have that type of support? You know, just thinking of the clients that you work with, and I think people that do have access to a health coach, to have someone who can support you in that way and help you to figure out what it is that you need to move forward. So thank you so much, Sophia. So if someone does want to reach out to you, how can they find you? Is there a way to reach you? Do you maybe have a website or something else?
I have a website, Sophia at smjwellbeing.com, but probably the best way is on LinkedIn, just Sophia Murray John, and look forward to speaking, catching up with anyone who fancies the chat.
Lovely. Thank you so much. Thank you, Sophia. Thank you so much for allowing us to get a bit of a glimpse of what your life looks like. And yes, just want to acknowledge you for the very important work that you're doing. And thank you so much for taking the time out to have a chat with us today.
Thank you. Thanks for the opportunity. And it's lovely to meet you and spend some time with you.
If you have a passion for health and wellness, and you would like to make a difference in the lives of others and discover a new rewarding career in health and well-being coaching, visit www.healthcoachesacademy.com to find out more.